Electrophysiology is a subspecialty of cardiology that's interested in arrhythmia or electrical disturbances of the heart. Dr. Hetel-Bhakta of Desert Regional Medical Center in Palm Springs explains how the heart functions.
If you look at the heart, there's three different components in there. One is the muscle, the other is the plumbing, which is all the arteries of the heart, and the other is the electrical, which is all the wiring that goes inside the heart. Because if you look at the heart, it's basically a pump. And when you think about it in a pump fashion, it needs a couple of things. One, it needs electricity to run it, and the other thing it needs power supply of sorts. That's the arteries that give it blood and oxygen. So electrophysiology deals with the electrical systems in the heart, and other parts of cardiology, interventional cardiology, deals with the plumbing side of the heart.
We asked Dr. Bhakta what brings patients to see him.
What I mainly deal with is what's called arrhythmias, which is basically a technical term for bad heart rhythms. So normally the heart beats in a very sequential fashion, which is a normal rhythm of the heart. And when that rhythm gets disturbed, whether it's too fast or too slow, you tend to have what's called arrhythmias, and that's what people mainly come to see me for.
Dr. Bhakta told us that once you've been diagnosed, there are several ways to treat the condition.
Depends on the severity of the symptom and the severity of the problem. So if it is a lethal problem, then that needs to be treated very aggressively. If it's a simpler problem, you can treat by medications, or you can treat by something called ablation. Now, medications everybody's familiar with. Pop a pill and it makes you feel better. The ablation is a procedure that we do where we take wires basically from the vein inside your leg, and we take the wire up to the heart, and then we park the wires in different parts of the heart. And once we've pinpointedly located where the problem is, we can use microwave-like energy, which is basically like radio frequency energy that heats up the heart tissue, and it burns the bad circuits inside the heart. And once we cut those circuits, you will never have that problem again. So it's virtually a cure. The more serious problems where the heart rates are so fast where you cannot be treated with ablation, there's something called a defibrillator. What happens when the heart rate goes very fast? So if you think about the heart pumping, it squeezes the blood every so often. Now, there's a certain rhythm that it squeezes in. Now, if it were to start going 400 or 500 times a minute, it won't have enough time to relax so that it can fill up, so it can squeeze again. In that case, the heart just ends up twitching, and when it twitches, no blood moves. That's the lethal fast arrhythmia. Now, when people have that arrhythmia, they drop dead. They go into sudden cardiac arrest and no more blood pumping around. So the treatment has to be very, very fast. Like if you look at any of your TV shows where you have the paramedics, if you have a person found down, what's the first thing they do? They check for a pulse. And then what's the next thing they do? They break out the pads and shock your heart. So there's a device that does the exact same thing. What it is, it's a pacemaker-like device that we put on the chest, underneath the skin, and then we take wires that go inside the heart, and those wires are then attached to the muscle of the heart. And that wire will continuously monitor your heart. And if you ever have this bad heart rhythm, it will detect it and shock you out of the bad heart rhythm. So it saves your life at that point.